For the first time in nearly 2 decades, Douglas County has a new health director. Dr. Lindsay Huse' first day was Tuesday, and today she sat down with 3 News Now for a conversation on her new role. She talked about the Delta variant, how to get more shots to the community, among other topics. 3 News Now producer Aaron Haggerty shares more.
Being a health director is something that I guess has kind of been on my career bucket list for about 20 years. And coming back to Nebraska felt very natural.
Dr. Lindsay Huse comes to Douglas County at a time where public health is very much in the public eye.
As far as why now, why not? Yes, we're in the middle of a pandemic, but this is what we trained for. This is, those of us who have made public health a career, these are the things that we have been expecting something like this to happen for many, many years.
Huse has spent the last 5 years as a nursing state supervisor for the Wyoming Department of Health. Originally, though, she's from Gary, Nebraska. She earned her Bachelor of Nursing from UNMC here in Omaha in 2001 before working as a public health nurse at Lincoln-Lancaster County Health Department. She takes over for Dr. Adi Poor.
So I hope to really do her legacy proud and continue her work, making this a healthy community. My focus really is on people, and so I think what you'll see with under my leadership is that it will be a very personable health department.
Health officials continue to push vaccinations against COVID, and after the Delta variant has emerged in our area, that effort isn't stopping.
So we do know that the Delta variant is more transmissible than the other variants that we've seen so far, and we know that people can get pretty sick with that. So we want to make sure that people are continuing to seek out the vaccination if they haven't yet done that.
The Delta variant accounts for about half of new cases. She said it looks like this strain could cause a more severe sickness than others. It's another reminder that the fight isn't over.
The healthcare system is beyond exhausted. They would love for the pandemic to go away. All of us want it to be over, and I completely understand that. It's so important right now, first of all, that we don't lose sight of the fact that it isn't over.
This week, the Biden administration announced an effort to go door to door to encourage vaccinating against COVID-19. As of now, Hughes said that isn't on the department's to-do list.
Right now we're not really looking at doing that. We have a number of pop-up clinics that are happening. We have a number of avenues through which the vaccine is being offered. So right now that seems to be sufficient.
And neither is making any changes to the county's virus dashboard online after the statewide one was discontinued recently.
We want to ensure for transparency and just to ensure that they have the best data they need to make those safe and healthy decisions. We're going to keep that dashboard up here in Douglas County for this foreseeable future.
She says she expects the county's vaccination rate to slowly rise through the rest of the year.
In aggregate, over the age of 18, we just got some additional data today that shows that Douglas County residents, we are just over 70%. A few days over the national goal of having 70% by the 4th of July. So we're really excited about that.
And a realistic target of the adult population to be vaccinated by the end of the year? She said 5 to 10%.
Those who just haven't been ready yet to get the vaccine, as they're able to see that it's safe and effective and people haven't had, a lot of negative side effects and things like that, they're going to just kind of trickle in. So it's going to be a slow push between now and the end of the year. So 10% is probably a little ambitious. 5% might be a little bit more realistic.
Aaron Haggerty, 3 News Now.
Dr. Huse also talked about pandemic fatigue. She says it might help to look to those around you to step back and see that we're all going through this together. So we should give each other some grace.